Looks like I needed to unmute myself. Hi, everybody. Good afternoon. Welcome to the Scope at Lunch, a special edition of the Scope podcast. My name is Paige Heitman, and I'm your host for today's webinar. We're super glad that everybody could join us today, and we're really excited to go ahead and get started. Before we get started, we're going to go ahead and touch base on a couple of housekeeping items, so bear with us. We'd like everyone to know who everybody is, so please ensure that your name is accurate. If you need help with this, please reach out to us using the chat box feature. I'll be moderating the session with my Phelps Health marketing colleague, Hillary McCash. You guys can see her face on here. So one of us will be sure to help you out if you need it. Please feel free to reach out to us. We would also love to see everybody's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please feel free to turn on your video. Please note that each of you are currently muted, and if you're not, please go ahead and mute yourself. If you have a question that pertains to the topic being discussed, go ahead and add that question to the chat box, and we'll try to get that question answered for you guys at the end of the show. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person privately. We would encourage everybody to send your questions or comments to the whole group so that everyone can participate in the discussion. However, you are welcome to send a private question or comment if you do feel more comfortable doing so. This session is a time for all of our Phelps Health panel of experts to share their knowledge and expertise of the COVID-19 situation with each of you. We ask that you be considerate and respectful of the panel members and the community members that have chosen to spend their lunch hour with us for this discussion. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use a hand clap, a thumbs up, a thumbs down to let us know if you like, love, agree, or disagree with whatever we're discussing today. Reactions are going to be in two different places, one either on the top or bottom of your screen, and one you'll see whenever the display is on the participant list. Also, if you're watching from our Facebook live stream, which Hillary is monitoring, feel free to ask questions, comment, or show us emoticons during our conversation. We love when you guys interact with us. We will be conducting a few polls throughout this Zoom meeting, so you'll get a chance to interact then if you choose to do so. And of course, remember the chat feature. Some of you may be using a mobile device, while others of you are using a laptop or computer. If you find that your features aren't the same or if you're having difficulties, we just ask that you guys participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. Before we dive in, I'll give some quick introductions for each of our panel members. Carrie Haven is the Senior Vice President of Patient Care Services and Chief Nursing Officer at Phelps Health. Dr. Nathan Ratchford is the Senior Vice President and Chief Medical Officer of the hospital and also serves as the gynecologist.
Paige, I think you muted yourself.
Sorry, guys, I'll go ahead and start at the beginning. So we have Dr. Nathan Ratchford, who's the Senior Vice President and Chief Medical Officer of the hospital and also serves the community as the gynecologist. We have Ed Clayton, who's the President and CEO of Phelps Health. You guys may have seen him out and about in the community. And then we also have Dr. Brian Creedy, who is an ENT or ear, nose, and throat provider and the Medical Director of Surgical Services at Phelps Health. So before we get started today, we want to go ahead and start off with a polling question. So I am going to go ahead and pop that up and hopefully, let me go ahead and restart that. And if everybody can see that, go ahead and take a couple of seconds and let us know how safe you guys feel during a hospital visit since COVID-19 started. And we'll take about 10-15 seconds to answer that. Great, I'm gonna go ahead and end the polling and share the results with everybody. So it looks like about 74% of everybody who's on our call today feels pretty safe. 24% feel kind of safe and 3% feel a little unsafe, which is gonna be one of the first things that we talk about today. So I'm gonna go ahead and stop sharing this. Carrie, this first question is going to be for you. How has Phelps Health pivoted since COVID-19 started? And how have we continued to care for patients while also keeping employees safe?
So we have come a long way since COVID-19 started. When we first began to going through this experience with COVID-19 or coronavirus, we made a lot of changes in the facility. We limited the procedures that we did here at Phelps Health to those that were medically necessary or emergent procedures. We stopped things like elective surgeries or elective diagnostic procedures. We limited visitors so that there were no visitors in the hospital at all. So if you were a patient, you came in by yourself and you were not allowed to have visitors. And then we screened everybody that did enter the building or any of our locations to make sure that there were no COVID-19 symptoms. Everyone was wearing a face mask. And we really went into an extensive planning phase to make sure we were ready if we saw an outbreak of coronavirus in this area so that we could take a surge of patients. We increased our volume of medical surgical beds and ICU beds to accommodate that. But as time passed, we didn't see an outbreak in this area, which I think is in part due to community planning and preventative things that we've done as an organization. So we continue to evolve through this process. The CDC, or Centers for Disease Control, puts out recommendations and guidelines for hospitals, for communities, and how to deal with COVID-19. And we follow those recommendations and best practice advisories. So what's changed now is we do allow patients to have visitors in the hospital. We do continue to screen anyone that enters the organization, whether it's an off-site clinic, an off-site office building, or the main campus. And we have everyone that enters the organization wear masks. So our goal is to provide a good patient experience in what is now becoming the new norm. I think that's the thing we're seeing, is that this is the norm, and we're trying to figure out how to adapt and adjust what we do to make it a satisfying experience. We now we are able to do elective cases. Our volume is back up to what it should be, the normal of what it should be. And we just continue to improve and provide ways that we can be safe to our employees, our patients, and visitors as well.
Thanks so much for that great response, Carrie. I'd like to open that up to any of our other panel members if they would like to add anything to that. All right, we'll go ahead and move on. This next question is for Ed. What does Phelps Health anticipate for the future of healthcare regarding masking requirements, screening stations, and other types of hygiene protocols?
Well, what I would say to that question is, first of all, we're still relatively early in terms of what a pandemic does and means, and our understanding of what the COVID disease does to our patients and those that that become have the virus active within them. So what we've learned over the last few months, whether it's here at the hospital, whether it's out in the community, whether it's participating in whatever activities we participate in outside of what we do on a daily basis, there are some basics that are important. The masking when you can't maintain social distancing. Of course, social distancing is something that's very important to limiting the spread of the disease. Masking, which we require here as well, and then also just general hand washing, safe hand hygiene is important as well in terms of the spread of the virus. And so where we're at today, I think in terms of what we're doing here at the hospital, as well as what we're advocating for in our community, is where we need to be. Continuing those screening stations within the hospital, making sure our employees and those that enter our facility are wearing masks to help prevent the spread of the disease. where possible within our organization and in our community, making sure we're maintaining safe social distancing. So I don't see that changing anytime soon. I think we're still early enough in the pandemic. We've seen the spread of the virus accelerate over the summer, and so quite frankly, we don't know what the future holds. And maintaining those basics, doing those very basic things, is what we need to continue to do to ensure that we're caring for our patients and our employees and our family members in the way that's the safest and best for them. So in terms of Phelps Health, you can continue to expect to see those screening stations, the masking requirements, and some of the provisions that we have in place to ensure social distancing where we can throughout the organization. Expect to see those for some time to come.
Fantastic, Ed. Something you said that really stuck with me is we're where we need to be, and we need to continue to do the basic things. And I think that's a great segue into our next question, which is for Dr. Radford. Are virtual provider visits here to stay? So we call those telehealth visits. Can you talk a little bit to that?
Sure. So the short answer is all indications would be that yes, we're going to continue to provide virtual visits, likely permanently. The little bit longer answer is historically, healthcare systems like our own have struggled on what's the best way to provide for virtual visits. Virtual visits have been around for a long time, actually, either by phone call, by email, electronically, and things like that, and more recently with video conferencing capabilities. Of course, there's a lot that goes into that with security, internet access, the appropriateness of what the care that's being sought for virtual encounters. And some patients and providers don't do as well with virtual visits as what they might do with a traditional face-to-face encounter. One of to turn a negative into a positive, one of the positive silver lining learning experiences that we've had at Phelps Health with regards to virtual provider visits is something that we've known about and thought about for a long time that was just never really at the point to be implemented. In the setting of this pandemic, we were able to pull together and make this happen quite quick for something as big of a service and as hard as it is to pull off, and it's been very successful. I think that going forward, there's questions about now that a big group of patients have had exposure to virtual visits. There's questions about how much patients want to continue that, and we're learning as we go along the best way to provide virtual visits. So again, the short answer is I think it's here to stay, but it's like a lot of things that are going on right now with the COVID pandemic. It's a fluid and evolving situation.
Great answer. Would any of the other panel members like to add any additional insight?
Yeah, I've actually seen several benefits to it. There are several types of patient visits that don't require a trip to the office and can be done in a more timely fashion, and allows some more flexibility to patient schedule. So I think we're going to see this actually progress and expand a little bit here in the future. So.
Fantastic. I think you're right. As a marketer, I think we can agree. So moving on to our next question. This one is for Dr. Creedy, and it has a couple of different parts, but we'll start with this question. Should we be concerned about the uptick of COVID-19 cases in our community?
Absolutely, we should be concerned about this. This whole process started for us back in December and January. We started making plans for this, and we saw a upswing in activity at the hospital beginning sometime in March. So we were prepared very, very early for this, and our case numbers remained relatively stable for several months. But within the last, I'd say 4 to 6 weeks, we've seen quite an increase in cases, and that's the same thing we're seeing across the country. We've got folks in this community going on vacation, going down to those higher density locations where the infection rates are a little bit higher. So yeah, this is a concern.
So my next question to that is, can you talk a little bit about the difference between hospitalizations, death rate, and positive cases? What types of data should we be focused on right now?
So let me go through the numbers real quick. So hospitalizations essentially addresses the availability of healthcare services in the community. So as COVID numbers go up, eventually you're going to see increases in hospitalizations, increase in ICU and ventilator usage. Fortunately, our case rates have remained relatively low here. Our hospital's been more than prepared to get ready for those sorts of things, and we haven't had a huge uptick here. But you hear of places in Texas and Florida where their ICU numbers are above capacity and things like that. So hospitalization covers essentially healthcare availability in the environment. Kind of gives you a sense for the degree of infection rate. Now, death rate. That essentially means the number of folks that have died that have tested positive. And I think as of today, I was looking at the numbers for the US, we are around 4.5 million cases and close to 150,000 deaths. So the death rate for the United States would be calculated somewhere around 3.3%. Fortunately, it appears as those numbers have been going down, and we'll have to wait and see how things go as things develop. Down in the Sunbelt states, case numbers have gone up quite a bit. But fortunately, the age group of folks testing positive has shifted from some of the older folks to some of the younger middle-aged folks that can handle this a little bit better. So that's where death rate comes in. And positive cases, it's pretty self-explanatory. That's just a number of folks that have got a test and tested positive for those. So.
Great. So how do we get tested for COVID-19 or even receive the antibody test if we think we have had COVID-19?
There's a couple of ways in our community you can go about doing that. If you have a concern, you can certainly call your physician and they can write an order for you. You can come through our screening tent. If you're not feeling well and you're concerned that you may have COVID, you could come to our screening tent as well. You don't necessarily need an appointment. You can come through. We'll screen you and get you tested for that. We also run into some issues where a lot of folks are coming back from job-related trips to where they'll need tests. We can also offer that through our screening tent. So the best thing to do is if you're not feeling well, like I said, you can stop by the hospital, come to our screening tent and get screened, or you can call your doctor's office and an order can be placed for that test to be done.
That's great advice. Now, one more question and then we'll move into our next polling. So why is there such an extraordinary effort being done to increase testing availability? And we've seen that in our area specifically.
The availability of testing is important for a couple of reasons. Number one, it gives you an idea for what's going on in the community. So if we've got tests available, we can detect those cases early, do some things to mitigate that risk, to spread it to the at-risk communities and so forth. So that's number one. Number two, the hospitals offered several mass screenings recently, so it also gives you a sense for what the community infection rate would be. But the biggest thing is it really helps you mitigate that risk. And if you test positive, we can give you some advice in regards to how to prevent that spread to other folks. So the testing is crucial.
And I just had a question come through that I think is pretty relevant to what you're answering. Are there any plans for more community testing events? And whether you want to answer that or somebody else on the panel?
I couldn't speak to that. Maybe Ed can.
Yeah, so our focus right now in terms of the community is the not too distant future, we'll have the students from Missouri S&T beginning to reintroduce themselves into our community. And so we're working with the university as part of that process. And that's kind of where our focus is right now in terms of, I don't want to use the word screening per se, but the testing of individuals in our community. These screening events, they sound easy to put on. We've done a number of them. We did one here in Rolla, we did one in Waynesville, St. Robert, one down in Salem, and one in St. James. And it requires a number of partnerships. What we're seeing right now in terms of just being able to offer a mass screening is what's becoming a much more limited capacity. I will say overrun. Our lab partners are being overrun with just the sheer numbers of tests that they're being asked to process. And so that somewhat limits our ability to do more mass screenings in the near future. We'd certainly like to do them. To add on to what Dr. Creedy says, it's great information to know what's going on in the community. And that's the what kind of penetration that COVID has in our community. But right now, I would say our focus, because we do have limited resources, is what's happening with the S&T students as they come back into our community.
Great. Thank you so much for answering that off the cuff, Ed. So now we're going to roll into our next polling question. Let me go ahead and pop that up for you all. And this one's kind of fun. So how risky do you think swimming is? I'll give you guys, again, about 20 seconds to answer this. And there's no right or wrong answer. Got about 5 seconds left. So it looks like we have a mix. We have some people who think that swimming is pretty low risk, moderate to low risk, just regular moderate risk. We have a couple people who think it's pretty high risk. So this will be some fun news for you all who think it's high risk or moderate to high risk. Swimming is actually moderate risk. So we'll start this one off with asking Dr. Ratchford a question. And the question that we're going to ask him is, how do we weigh what activities we should or shouldn't be doing right now that events are starting to pop back up? So one of those events might even be swimming.
Sure. I mean, I feel the same thing as everybody else when I'm talking to friends and family. We're all wanting to go back and do as much normal stuff as we can. And what's more normal during the summer than the quintessential activity of going swimming, right? So risk relates to different things that you've got to take into account. Remember, the coronavirus, this is a respiratory virus. So it's not passed in the water, it's passed through the air with respiratory droplets. And the more packed in a confined space you are with other people that could be contagious, the more prevalence there is in the community of the virus, which all indications currently, like what Dr. Creedy said, is that our prevalence is low in this community. I hope it stays that way, but we monitor that closely. You've got to factor those things in. So if this question for somebody means you've got a pool at home and you're going to invite some friends over, or you're going to go to a friend's house and go to their private pool, depending on who's going to be there and how many people, it might be lower risk than, we all remember the pictures from the Lake of the Ozark back on Memorial Day weekend and 4th of July, where it's virtually standing room only in those pools with people from all over the region. That's going to be a higher risk, obviously. So what I've told people about returning to normal activities like this is you've got to use your best judgment. There's going to be certain situations that make more sense than others.
Wonderful. And this is a great, again, segue into our next question for Carrie. So now that restrictions have been lifted and people are allowed to go to Lake of the Ozarks, everybody is super excited to start resuming those normal activities like going to the lake, going camping, going to the zoo, and even going out to eat. But what has your personal transition been to a new normal, and what should we be doing as community members, not just healthcare workers, to help ensure the safety of our family and those around us?
That's a great question, and one I hear a lot from people that family and friends that are out in the community.
Mm-hmm.
So personally for myself, I'm going to echo a little bit of what Dr. Ratchford said. I think it's situational. I think number one, we all have to be aware. We have to be aware that it's not just, and I preach this to my kids actually, it's not just you that is maybe impacted, but it's who you might take it to or who you might be exposed to as well. So you have to be aware of that. If, for example, my son if he was exposed and maybe was positive for COVID, I have to think about my parents, myself, other people, friends and family that might be exposed. So I think before you make decisions about doing activities, you have to consider that. Then you have to look at where are you going and what are you doing? Is that an area that has had more positive cases? If that's the case, you might not want to go to that area. It's a higher risk. Social distancing is so important, and face coverings and masks. I recently did go to the zoo, as a matter of fact, so this is a great question.
How did I know?
I know. And I did evaluate before I went what restrictions were in place in that location. I did travel with a mask and make sure that we could stay socially distant. We did choose to not do some of the other activities that would have been on our to-do list because we couldn't stay socially distant. We would be indoors, and we felt like that was a higher risk. So I think awareness is important. Again, it's personal judgment, but I think everybody has to realize, as we are tired of the mask, we're tired. We get a little bit of fatigue about having to be worried about this all the time, that we still have to be alert and aware that what we do does impact others around us.
Great response. And I'll open this question up to all of our other panel members to kind of give their expertise and guidance on maybe what they're doing as well out in the community.
Well, I think Carrie said it. You have to use personal judgment. My summer activities involve a lot of time spent with my kids and baseball and those kind of things. And certainly the way that has worked this year has been different than in past years. It's almost when you travel and go to tournaments, afterwards you get together with other folks and you're in a hotel lobby that's crowded, and we're still doing the activities in terms of the kids playing sports. It's outdoors. With baseball, my personal judgment is that the risk is low enough, and so I'm comfortable with that. But I'm not doing the activities maybe later in the evening that we would have done before we would have went out to eat somewhere, before we would have maybe been in the lobby with other ball players' families and gathering in a tighter enclosed indoor area. This year, it's we order something that we go pick up and don't go in and eat, and we don't do those same activities. So I think you can still do a lot of what you want to do, but you have to use your personal judgment and modify that to take into the proper safety precautions.
Absolutely. So that will lead us into our next question for Dr. Creedy. Why should we be wearing masks? I know Ed talked about that, so did Carrie, about how if they're deciding what types of events they can and cannot participate in for themselves and their families, they're going to make sure that they're wearing masks and protecting themselves. How does wearing one even protect us?
Well, there's a couple of things that go with wearing a mask. There's different types of masks. Most of the masks you see people wearing out in public, like the cloth masks or the most of the masks that we wear in the office, those aren't really about protecting ourselves. There is some of that there, but they're more about protecting the other folks around us. And then when you talk about caregivers that are caring for folks that actually have the disease, there's a different type of mask. You've seen, these N95 masks. These are designed to protect the wearer. These were very precious at one point, and they still are, but we've got a much better supply than we did. So you've got the mask that you would wear that you would protect yourself, which there was a limited availability. And then you've got, the run-of-the-mill mask that you see most people wearing out in the community, and so on and so forth. So this has obviously been a hot point in this country, and unfortunately it's become a little bit of a political debate. But wearing a mask, it's not about protecting yourself. When you wear a mask, you're protecting your grandmother, you're protecting your aunt who's being treated with breast cancer, you're protecting your kids that are on immunosuppressive disease for something like that. So it's about protecting others around us, and it's more altruistic than protecting yourself. So it's about other folks when you're wearing this mask, which is why it's so very important the CDC recommends this.
Great answer. We're going to go ahead and move on to our next question as well. This one's for Ed, and it's a little broad. How does our community and health system continue to be motivated and have long-term vision when we're faced with constantly changing circumstances? So we talk about this new normal, but we don't even really know what that is. How do we plan for and support one another when the future continues to be so uncertain?
Well, in terms of motivation, I think my motivation comes from seeing what's happened in other places that have had, the larger incidence of COVID. If you look at what happened in New York and on the West Coast earlier, what you're seeing going on in Florida and Texas and some of those states now, if we wanted to look at an example as to why we should be motivated to make sure that we're taking safety precautions, I think those are the things you look at. We've been very fortunate here to not see that same prevalence of COVID, but it wouldn't take much if we let our guard down. So I think that, to me, that's how we stay motivated. Again, I mentioned earlier, back to the basics. I think just continuing to focus on those basic things, the social distancing, the proper hygiene, the mask wearing, doing the right things, that certainly helps. I think early on in the process, Dr. Creedy mentioned earlier that we started our planning for this back in January. Certainly, we put operational plans in place in March and April when we thought we'd have a huge amount of hospitalization. So we have contingency plans set aside if we do see a large uptick here locally. And so I find comfort in our planning process because that's available if we ever need it. And so, I think, again, that's where we find the motivation. We continue to plan by seeing what's going on in other places, following guidelines from CDC, making sure that we're doing the things that we need to do to keep our organization, our employees, our patients, and the community as safe as possible.
Absolutely. So moving in next, we have some time for some participant questions, and we've had quite a few come through. If we have anybody else that has any questions that maybe they haven't had a chance to ask yet, go ahead and send those in. We'll make sure that we answer those if we can. So one of the first ones I have, and maybe this one, Ed, would be good for you. Is there any advice for the community as we see thousands of college students come to town over the next month?
Well, I think my advice would be, and some of the retailers are starting to do this themselves, as you're out and about in the community, especially I'd say the first few weeks as the students become reintroduced, do the things I was just talking about, the mask wearing. I think Walmart has moved to a mandated mask wearing, although I can tell you I was in there a couple of nights ago. I was wearing one. I saw people that weren't, so I don't know how mandated it is at this point. But doing those things, I know the university is focused on that as well as educating their students when they're coming into our community what they need to do to properly safeguard themselves and us. And so really, again, it comes back to the basics, and that's what we can do and that's what we can control. And so as those students become reintroduced, I'd say if you're going to go to the store, take proper precautions, avoid large gatherings, those kind of things that we've been talking about and that others have been talking about since March. We need to continue to do those and maybe more so during that, let's say that first 2 to 3 weeks as university students are reintroduced to our community.
Great, thanks, Ed. Another question that I have is, how can we develop plans as a family to be safe whenever we go out and about in the community? How can we see other families who maybe are wearing masks and maybe we're not, or maybe we are wearing masks and other families aren't? How do we have those conversations together?
I can comment on that. So like I said, the act of wearing a mask isn't to protect yourself. It's really to protect others around you. So it's kind of a good life lesson for your kids that, look, we're in this together and we need to make a concerted effort to help other folks out while we can. So I think that's kind of a good talking point to go from, and that would be a good place to start.
Perfect. Thanks, Dr. Creedy. Another question that we had come through is, does Phelps Health have any plans to upgrade HVAC systems in their facilities or to add air purifiers to break rooms or dining rooms where staff must remove their masks to eat or stay hydrated?
I can probably speak to this a little bit, and Ed, you may want to add as well. Unfortunately, with COVID-19 or coronavirus, air purifiers are not the solution. It has to actually be a negative pressure system. So it's more about airflow exchanges And we meet regulatory guidelines for those airflow exchanges, so we know what those are across the facility. So regardless of where we're at, we still have to keep our guard up, not gathering in a place with a lot of people, continuing to wear a mask, socially distancing. Those things are more important than, and if you added an air purifier, you're probably not going to have any effect on COVID specifically.
Ed, did you want to add anything to that?
I would just, I don't think I have a whole lot to add to it. I think Carrie's absolutely right. Our focus early on was the safety of our patients, and we did move several of the locations in the hospital and change those airflows to provide patient safety. And we'll continue to look at things as we move forward. One of the things we're starting to look at now and in some of our areas are I'll call them plexiglass shields that help protect our patients and our employees as they're interacting in certain situations. And where those make sense, we will install them. So we'll continue to roll off things like that. I don't think we've had specific talks about the break rooms. But as we move forward and identify new areas that we need to address, we'll look at those at that point.
Great. Thank you both so much. And I have one more question. It's kind of a unique question, and we may not even know the answer to this. But a vaccine for COVID-19 is in the works currently. We've all heard about that on the news. However, even a vaccine was ready by January, which would break like every record on the books, how would people in the labs who are creating the vaccine know that they've developed a vaccine that works? So I think the question behind this is, if a vaccine is created this quickly, how do we know that it is safe?
So that's really the problem with trying to shorten that timeline for vaccine development. As you would expect, developing a vaccine has much more to do with actually making it and producing it. There's also a lot of testing that goes into it to make sure that it works and that it's safe. So I'm excited for a vaccine to come out, and certainly the sooner the better. But I'm worried that some of these promoted timelines that you hear about in the news are a little exaggerated.
And as far as safety and so forth goes, you'll hear all of these different types of studies, like a phase 1, a phase 2, a phase 3 trial. For most studies, a phase 2 trial is typically looking at efficacy and safety. So the numbers will be a little bit lower now. And I know some of the vaccines have moved into phase 3 testing, where they're actually giving the vaccine, looking at safety, making sure it works, and making sure it confers immunity, which essentially means your immune system is going to prevent you from getting the disease. So it has been ramped up, and for good reason. But fortunately or unfortunately, we've got plenty of disease here in the United States, which allows these sort of tests to get done a little bit quicker than usual. So.
Great, fantastic insight. And we did have one more question come through, and I think we have enough time to answer it. I know someone who is tested at a drugstore, and it's been 15 days and still no results. A message was received that Quest Lab is taking longer, which makes sense because we're doing more testing. What is the person to do during long waits for lab results?
So I can try to answer that one. Our recommendation when you're being tested is that you self-quarantine until you have those results back. In the community, if you're being tested and you have a long wait for results, the best course of action, if you have a question about what should you do, have you been self-quarantined long enough, is to call your local health department. They really will be the best source of truth to answer that question. Or if they can also call their primary care provider and ask those questions of their physician or provider as well.
Thanks so much, Carrie. I think you did a great job answering that. So we're going to answer one more polling question, and then we will wrap up today. Let me go ahead and launch this really quick for everybody. We'll give you about 20 seconds to answer this for us. Got about 5 seconds left. All right, I'll go ahead and share this with everybody. So our panel, you guys did a pretty good job today. Awesome, good deal. Let me go ahead and close this and then we'll wrap up. So thanks so much to everyone for tuning in to the Scope at Lunch today. A huge thank you to each of our panel members for joining us today. We really appreciate all of the insight you've been able to share with our community and throughout this whole COVID-19 situation. We couldn't do it without you guys, obviously. As a reminder, the show has been recorded and will be emailed to all participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you really like this show and would like to know more, you can check out other episodes of The Scope on YouTube or visit phelpshealth.org. Thanks so much, everybody, and have a great rest of the day.